Radiography interviews can really catch people by surprise, and I cannot emphasize enough how important it is to prepare for your university or your apprenticeship interview. This isn't an easy interview, and I've seen a lot of strong candidates struggle with this, but all you need to do is prepare, and I'm going to go through the exact framework. In my last video, I went through the 4 main categories of questions that can come up. Today, I'm really going to focus on motivation questions, and we'll give you a new bonus ethical scenario at the end. If you're new here, I'm Dr. Rads. I'm a career coach, and I've been helping people to get into their dream career for the last 7 years. That can be in healthcare or even careers outside of healthcare. Radiography is a rewarding career, but it has become increasingly challenging. Radiography still has good career prospects in the long run. For example, getting into CT, MRI, working as a locum, or even working as a sonographer. But that's not why you're here. You're here for radiography interview advice. Now, if you do want the comprehensive interview guide, I'm going to leave that in the description. That's got lots of past interview questions, model answers, and over 15 ethical scenarios for you to practice and learn the exact framework that you need. Today, let's focus on the motivation questions. Why you? Why this university? Why have you chosen radiography? And I'm going to go through how to answer it, the framework to use, and some model answers that you can use to help you formulate your answer. So firstly, why you? Why would we pick you for this radiography course, and why not somebody else? There's 3 parts to this answer that will really make you stand out. The first one is mentioning your skills and qualities. The second part is giving evidence and examples to back up your claims about your skills. The third part is linking that back to radiography. Now, sometimes for a university interview, they've invited you after reading your personal statement, which they could have read about 4 to 6 weeks ago. But don't walk in there assuming that they know everything about you because they've just read your personal statement. Always assume that they don't know anything. They could even have it in front of them, but I still want you to share your experiences as if you've never told them anything. If you've done extra things like volunteering, you've had a retail job, anything extra you've done that another applicant might not have done is what's going to make you stand out, and you need to bring up these things. I think I'd be a really strong candidate for radiography because I feel I've got the foundational skills and qualities required to make a good radiographer. For example, I've built my communication skills, I've worked in a team, I also have built my problem solving skills. I built these skills through volunteering at a care home for 6 weeks. I would go and help the elderly residents. Many of them had dementia, many had mobility challenges. I worked as part of the team, I communicated the residents' needs back to the team. That helped me to create engaging activities which were also fun for me to do, really rewarding, but it also helped to get them engaged. It was during this time I also realized a lot of them had mobility challenges or were really prone to fractures. They might have had osteoporosis, and that helped give me some insight into the healthcare side of things, and that really helped build my compassion and empathy. Getting that exposure to a caring environment not only developed my skills, but it really drew me to a role in healthcare where I know I can have an impact, and all of that comes together in the role as a radiographer. I've also had a retail job for 6 months where I've been communicating with diverse members of the public. It's really helped build my communication skills. I believe that's such a core skill to have in a healthcare environment. I recognize that NHS is demanding. It's a fast-paced setting, but that's exactly why I want to go into it. I want to be challenged. I really want to have an impactful role. And through my exposure, through care home volunteering, working in retail, and also doing work experience, all of that has led me to radiography. And as somebody who's always open to learning, I think it'd be the perfect career for me to progress. Now, there's no specific right answer for this. There's no model answer, but what you really want to show off is what makes you different, what makes you above average. What extra have you done beyond school? What extra research have you done? Do you understand the profession? Do you understand the challenges involved working with the elderly? Now, what I want you to do is prepare your answer. Try and bullet point your answer and practice saying it out loud again and again. Why have you chosen radiography? Now, there are 4 parts to this question. Now, remember, diagnostic radiography and radiotherapy are very different careers. Make sure you know which one you've applied to. The full list of roles and responsibilities of what a radiographer, a radiotherapist does can be found online, just researching NHS careers, doing virtual work experience, or also in the guide as well. 4 parts to this answer. First thing is understanding the roles and responsibilities. That should be shown in your answer because that is one big tick. The second part of the answer is showing off your exposure to the role, your insight. So that could be through shadowing, virtual work experience, researching the career online, watching day in the life videos. The third part is showing the qualities and skills needed by a radiographer, understanding it's a very practical role. The fourth part is realistic awareness of the challenges of the role. For example, understanding the demands of the NHS, back-to-back patients, patient frustrations, increasing waiting lists. I chose radiography because when doing my research of various healthcare careers, it stood out to me as such a unique role that involves practical, technical skills, but also a lot of empathy in patient care. I recognize a lot of it is not just taking x-rays, but also positioning the patient correctly, understanding the image that has been requested. I think that's such a unique role, and it forms a part of the diagnostic process, and that really appeals to me. As somebody who loves anatomy, loves physics, radiography really intrigues me for that reason. I gained more exposure to radiography when I did my virtual work experience. Through this virtual work experience, I got to see what a radiographer does day to day, understanding the patient's journey. I realized a lot of it is about safety, making sure patients are always prioritized. I got to understand the challenges of the role as well, understanding the increasing waiting lists, the pressure of seeing so many patients back to back, making sure everything is running smoothly. And I think that involves a lot of problem solving, and that really excites me because I've built my problem solving skills. I've done Duke of Edinburgh, I worked as a prefect, I worked as a student representative, and all of these things have come together to help build my skills in preparation for the challenges that radiography brings. What really appeals to me is how radiography is very patient facing. You're not just taking the x-rays, you're speaking to people on a daily basis. You have to show a lot of empathy, a lot of compassion. It's really a blend of practical skills, scientific understanding, and also communication. That's why radiography really appeals to me. Remember, there's no perfect answer. Another good way to approach this question about radiography is mentioning a personal experience. For example, I was on the receiving end of healthcare when I had an issue with my foot. So I was getting a lot of pain in my foot and my ankle for about 6 to 8 months. And the doctor wasn't really sure of what the cause was. I went to see a physiotherapist, and eventually there was a decision made to get an x-ray done. So it was only when that x-ray was done, we noticed a hairline fracture in the foot. And I realized how important the radiographer's role was in getting this diagnosis, because they were able to position me properly in a way to see the anatomy clearly. And I thought that was so fascinating. And even when the image came through and the consultant was talking me through it, I thought it was so interesting. The first thing I wanted to do was look at the image, see where the fracture was. It was so interesting to me that you could see something that you couldn't see with the naked eye. And I really started looking into different imaging modalities, and that really appealed to me. I noticed radiography was so practical, combined physics, biology, anatomy, and that was really intriguing. I also love working with people. I've been doing a lot of volunteering at the temple, and during this time we serve food to the homeless and to anybody who's coming in, and that's really helped me to speak to elderly, young people. And radiography is such a patient-facing career, and that's why it really appeals to me. I would try and keep your answers from 30 seconds to about 1.5 minutes. They really do want you to expand, and if you're going on too long, they'll always stop you halfway. If they feel like you've ticked all the boxes and they're happy with your answer, it's totally okay if they stop you. It's really important that you share as much as you can about your unique background. Now, the third common question is why this university? For this one, you do need to do research into the university. So looking up on the website, going to the open day, looking into their placements, the affiliations that they have with community clinics. Look at when they first give you exposure to patients. When do your placements start? Do they have anything unique about their course? Do they maybe have a module on ultrasound or a module on CT or MRI? What is it that makes them stand out? Here's a really strong example answer. So I've chosen this university after doing research on various different universities. I noticed a few things that were really unique about your course that appealed to me. The first thing I noticed was that you offer patient exposure really early. So we'll start our placements as early as the second term of first year. That really stands out to me because it means I can apply my theory practically, and I'm such a practical learner. I think that will be really important for me to get that exposure early on. The second thing I noticed is you also have a module on ultrasound principles. I think this is really interesting because I've looked into sonography as a future potential career. So getting exposure to all these different areas and different imaging modalities, I think that will be really interesting. The third thing that really stood out to me was something I learned from speaking to one of the lecturers at the open day. I learned a lot about the mentorship and the support that's provided to students. And I think that's reflected in the student satisfaction rates as well. That really makes your university stand out. Mentorship is so important, especially as a first year. That transition from A levels to university is a really, really big jump. And I want to feel supported in that. And I'm really looking forward to someday becoming a mentor for the younger students as well. So all of these factors really draw me to your university. That shows clear research. You know what the university is offering. You've looked at the courses. You've looked at the breakdown. You've not just randomly picked it because your grades meet their requirements. You want to make it really personal, relate it back to you, your qualities, and show why their university stands out against other universities. So easy to just copy and paste bits of the website, put it into ChatGPT, ask it to pick out the most important points and formulate an answer for you. You can definitely use AI to help you formulate your answers. You can even use the guide put it into ChatGPT, ask it to use that same framework, and then give it points about you and formulate your answers that way. If you do want the full guide, model answers, ethical scenarios, everything will be in the guide below. Now, the bonus ethical scenario for you: what are you going to do in a situation where an elderly patient comes in and they have limited mobility and they're not able to position themselves in the way that you need in order for you to get an accurate image? How would you tackle this scenario? Now, they're not looking for a perfect answer. There isn't always a model answer, but what they're looking for is systematic thinking. Think about who you would go to, who you'd communicate with, how you'd handle it, how the patient is feeling, how you're going to approach that, and what is the best way to manage this. What they're really looking for in this answer is your understanding of patient safety, respecting patient dignity, knowing when to seek help, but also being able to adapt and problem solve on the day. This is the 5-step approach. The first thing you'd want to do is pause and assess. Second thing is communicate and reassure the patient. Third thing is adapt where possible, but not pushing the patient. Fourth thing is seeking support, and the fifth thing is reflecting on the scenario. In this situation, my priority would be patient safety and comfort. The last thing I want to do is push a patient into an uncomfortable position that could potentially cause them harm. I would want to communicate effectively with the patient, explain the importance of getting really good positioning, but that we don't want to do anything that would make them uncomfortable or cause them significant pain. I would reassure them and see if there were ways that we could adapt the equipment or move things around so we could still get a good quality image without compromising patient safety. It would require me to have really good listening skills, really good communication, and I'd have to be patient. I would try to adapt in this situation, try to problem solve, maneuver the patient in different ways to see if the x-ray could be obtained. Also, don't want to keep taking x-rays that are of poor quality, as that could mean exposing patients to unnecessary radiation, which could cause them harm. So what I want to do in this situation is try and adapt, see if there's another way that we could get the image without compromising their comfort. I would try various methods, and if I was still struggling, the next step would be to seek help from a senior radiographer, to get advice from a supervisor, and see if any alternative method could be used. And the main thing through all of this is making sure that I'm prioritizing their safety, making sure they're comfortable. And after that situation, I would reflect on this. I'd seek some feedback from a senior member, or maybe speak to supervisors to see what else could have been done in that situation. They don't expect you to have the perfect answer. They don't expect you to know exactly what to do, but always think NHS values, patient safety, making sure they're comfortable, not causing anyone harm, always doing the right thing, seeking feedback, reflecting, learning from that. If you have any questions, happy to answer them. Make sure you subscribe to the channel, because I'll be creating more videos on radiography, future career paths like sonography, CT, MRI, or other alternative routes that you can go into in the future.